Lois. Let me get the next person here. After Lois asks her question, we will go to Bud Findley from Keene. Lois, it's your turn.
I just wonder why any thinking, caring person would not want everybody to have medical care and would allow people to suffer and die just because they don't have enough money or because they don't have insurance. I wonder why we just can't have Medicare. I have Medicare, and I am happy with it. I pay money for it, and it has done a good job for me. So why couldn't we just have a Medicare plan for everybody who cannot afford to buy their own insurance? I just want to add one thing. I don't even mind if it raises my taxes if everybody can have
Ask one thing. I don't mind if you express your views toward me, but I would ask if we respect everyone's right to ask their questions. And Lois, let me just say several things. I'm often asked, is health care a right? My answer is that it ought to be a goal. To try to provide health care for every American ought to be a goal. Clearly the challenge we face is how to pay for that. And I think we can have laudable goals, but if we can't pay for that without bankrupting the country and dramatically increasing the deficit, it could undermine our country's future and our ability to support the quality of health care system. I respect your position that we should put people under Medicare if they don't have insurance. I just will respectfully disagree, and that I think that leads us down the road toward a Canadian-style, British-style healthcare. Ultimately, that could undermine the quality of care we have. I do think it ought to be our goal to try to reach out. We have to do something about the increasing number of uninsured. And let me tell you why. It's not only that there are 30,000 adults and 8,000 children here in Johnson County who don't have health insurance, who are therefore one serious traffic accident or one serious illness away from bankrupting their families. But the uninsured cost of walking into that emergency room, an expensive way to get care, the most expensive way, an inefficient way of getting primary health care, they're walking in and getting care that's uncompensated, is putting an $1,800 a year hidden tax on every one of you who is paying health insurance. Because when you pay your health insurance bill every month or every year, you're not only paying for your health care costs, you're paying for part of the cost of those who do not have insurance. So I think we are on common ground, and that we ought to have as a goal trying to reduce the large number of uninsured here in Johnson County and the country in health care. We may not get 100% of the way there, but I hope we can move forward. And that's good for those that are uninsured. It would be also good for those who have insurance, because that $1,800 hidden tax this year for the uninsured could be $2,500 a year on your health insurance bill a few years from now. Thank you, Lois, for your question.
Thank you, Lois.